And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
If you people missed us last Sunday, that was because it was Super Bowl Sunday. And now we're back with more vigor than we've ever been before. Right, Doc?
Yeah, we played that game. We had to watch that, too.
That was an exciting game.
An exciting game, and I never watched those because they always look alike.
But this was exciting.
The uniforms change, but everything looks alike.
It was amazing.
But on this particular game, they had so much energy, and I watched the whole thing.
And I was willing, and I bet on Atlanta.
No, you didn't.
And they played so fantastic. And, you know, you got to give credit, whether you love them, whether you hate them. Belichick has got to be the most amazing coach that ever lived.
Well, was it him or the quarterback?
Oh, the quarterback's phenomenal. I think Brady will go down in history.
I don't think Belichick threw a ball, did he?
But he knew where to throw the ball. He told them. And, you know, when you have that much confidence in someone like Tom Brady.
Yeah, he's got help from above, though. There's a spotter way up there.
Oh, I thought you meant God. No, oh, yeah.
Yeah, it tells Belichick what's going on down there.
Well, they all have the same, but
yeah.
I mean...
Yeah, it's a well-oiled machine.
So you enjoyed it. Did you see the whole game?
I did, yes.
Yeah, you're like me. We're up all night anyhow, so you may as well watch the game.
But the one who should get a lot of credit is the guy who got the football with his hand over the foot. Remember that one?
That was Julio Jones. Julio Jones.
No, it wasn't Julio Jones. Edelman.
Oh, Edelman, yeah, but Julio Jones got the one where his feet he dropped out. I mean, they double-teamed the Gray Scott, but let's talk about what we're here for.
Okay, what are we here for?
I want to ask you, I wanted to talk to you. I'm reading all these articles about a torn meniscus.
Oh, yeah.
I'm not going to tell you what they say. You tell me how you would treat a torn meniscus. Go ahead. I made short, Doc. Like you said.
Torn meniscus is a sprained ligament. You remember now, there's no pain fibers within the knee. Are you listening? Write this down, people. This is important.
I'm listening because everything you're saying is in this article.
You got to know this is true.
Go ahead.
There is no pain fibers to tell you that anything is wrong with the inside of the knee.
That's what this doctor just said.
I just said that.
Okay.
Did you hear that?
Yeah, and so is this article.
Oh, he said that?
Oh, yeah.
He said that too?
Yeah.
Who said that? I got to send him a congratulatory note because nobody talks like that but me.
You keep talking, I'll get
Anyway, so the cartilage that they're talking about, the meniscus, is inside the knee. All the pain that you ever get is on the outside. There is a ligament that goes around the knee. It goes around its way and up and down and across ways and holds the knee together. The femur and the tibia holds them together. Otherwise, it would flop around. The muscles move the bones, but the ligaments hold them in. And
he didn't put his name in, just to let you know.
And that's where the pain fibers are.
Mm-hmm.
So when you have when they tell you have a torn meniscus, it is not. It is a sprained ligament around the knee. And we treat that directly. It goes away. You have no problem whatsoever. Do not get operated for that. That is not going to help you. That's only going to hurt you because once you have a scar tissue formed, then it gets worse and worse and worse. And then you end up getting your knee replaced or getting some fancy surgery. Do not do it. If you come to me, we would treat that, and you'll have no problem with it whatsoever. So you get all the motion back that you want, no pain whatsoever.
So according to this well-written article, almost, I'd say 95% of what you said they agree with except one thing. They say inflammatory drugs like cortisone.
Well, no, you don't. What they're talking about is putting it inside the knee.
Right.
We never do that.
That's exactly right.
We only put it on the outside where the ligament is, and it takes an exam to do that. MRIs do not help you.
And we know that as a fact.
Yeah, that's a fact. In fact, a lot of orthopedic surgeons do not order MRIs because of that. They're misread. See, the knee is just too simple. If you understand how it's made, all the component parts, you could examine for each component part. You don't need an MRI. And if you can't examine for it, you're in the wrong business.
You know what you just said?
You should be in finance or sell used cars. Don't treat knees.
You just said something that one of the biggest doctors at a very prestigious hospital said. Right now, they send all of their x-rays and this to a thing called MyChart, where a lay person like me reads it. And know what this doctor said? I made a point that no one sees that, because I want to explain to you what's going on. So basically, what a physical therapist can't explain it to you.
They don't
He
know.
has to.
They're not taught how
No,
to
exactly.
diagnose anything. They do specific things. And if you want to test them out, send somebody with a specific diagnosis and see what they do with it. They cannot do it. They don't just know how. They don't know how. And there's nothing, say nothing against them. I mean, they do some good stuff, but when you need specific treatments for a knee, that's not the place to go.
Well, you know what? I've seen it, so
Yep.
I know.
Yep.
You know, I've seen what you've done with knees. Now, let's go. There's another one here that's very interesting to me. We never spoke about. Weak ankle weakness occurs when you sprain, twist, or roll. Otherwise, the injury of the ankle keeps getting worse and worse in certain sports that you do. And the one thing that they said is physical therapy and surgery.
No, physical therapy should not be done. It should be, and surgery should never be done for an ankle or foot. Because why? Because you need mobility. These parts have to work. And once you get operated, you have scar tissue. I end up treating this stuff because these surgeons just don't have the answer to it, and you end up having scar tissue, and mobility is decreased. So that means you can't walk or run. And so I end up treating that because we treat scar tissue and get the mobility back. But that is the treatment of choice, get the mobility back. Surgery is not a treatment of choice. So if you go to a surgeon for that, you're making a mistake.
Well, we found that out now. Of course, they've called Dr. Pannozzo from all over the country to come down.
I had a call from Australia the other day.
Yeah, Australia.
Day
before, the week before that, you got one
Switzerland.
and Egypt.
Egypt.
I'm telling you, we could end world. We could have world peace if all these guys aren't hurting. I think the reason we're on such a problem is these guys are hurting. Okay. Now, getting back to the ankle, the reason why I said you could always listen to or call Leah on the air. Leah had that problem, an ankle problem, and was going to be put in a brace.
Cast.
Okay.
I mean, boot.
A boot. You asked her the famous 27 steps.
What's wrong with the boot?
Well, mobility.
Yes, it
You
decreases
decrease mobility,
You
so
don't
it
want
can't
to
get cured.
decrease mobility. Your treatment is to increase the mobility
Right.
all the time. See, it's the exact opposite. That what they're teaching you. Well, we'll put you in a boot, put you in a brace. We'll do this. Don't do that. Mobility is you want. Now, in order to do mobility, what do you need to know?
You need to know where the source of the pain came
And
from.
why?
Because
source and why. It's the,
Okay.
why it's.
I'm going to show you. I know why.
Yes, you know.
Once you know where the source of the pain comes, you go directly to the source of the pain and fix it.
Yes, and it could be a bunch of things
Yeah.
that could be causing that. So you really have to know your anatomy and physiology. You got to know what produces a pain.
When the people watch your show, I want you to pay a lot of attention to the questions that you ask. I was totally amazed, again, which I'll talk about that later, that how you are able to diagnose a pain, like with Leah, on the famous, we call this the 27 steps to recovery.
Right.
He's got it down to, after he takes you out of the serum, gives you a shot, you have 27 steps to create that pain. And no one has ever done it yet.
No.
They either go like, oh, God, I feel, Doc, why'd you do? And that happened with Leah. Referred pain. Did I get that right?
Yeah.
She had referred pain that was causing her problems with the ankle.
Down the foot. Down to the
Okay.
ankle.
Explain what referred pain is, because, we have new
Well,
listeners
it's
every day.
pain in various places is caused by other places. So it takes a long time to learn these pain patterns. See,
Over 60 years with you.
So all the little parts of the back, each one causes a pain pattern. And you have to know about this and how to find it. So that's why an MRI is not that good.
Because it doesn't show where the pain is.
It doesn't tell you where the pain actually is. They can read something, but is that where it is? You don't know that. You have to do it by examination. Then you have to know if they're correct, what's causing that. And then you have to know what's the secondary cause of that. See, so it's very complicated, and you have to know the anatomy and the physiology. Now, somebody called me this morning.
Already?
Yes. I hope they're listening to this show.
Oh, I hope so, too.
I'm going to talk specifically about this man who has a backache. He had a fusion done, the screws again. Don't do that. People, don't do that. It causes immobility. And what's the exact opposite? of what we do? Immobility. We want mobility, and you can't get it
If
when
you
there's
can't,
screws
the
holding.
inability to stretch.
The inability to stretch is what a pain is, and you can't move if there have two screws holding your bones like this. Boom. How are you going to move there?
Right.
So you have an inflammation in there, but you can't get the mobility back. So now you have a pain. Now you're coming in to see me. You're saying, I have all this pain. And I see the screws there. We just happened to, a woman was just
Now we're getting into the step. Now,
dropping by, and
can I explain what happened?
sure.
Dr. Pannozzo was taking care of a patient. As she was taking care of a patient, I was just talking to this lady. First time I ever met her, and she was telling me about all this pain she has right now. She's having trouble sitting. I said, and she told me that she had surgery. She had 2 rods. Am I right, Nick? She had 2 rods, and then they put a stimulator in her back.
Yeah.
And I said, "How you feel now?" She said, "I'm just so much pain, and it's going to cost me another $7,000 to do it again." So I said, "Why'd you do this? You're here. Talk to Dr. Pannozzo. He don't care. He'll tell you." She spoke to him. She went in, and she got, I don't remember, I was in there, 2 shots, and she was actually teary-eyed because I said, "Is everything okay?" She said, "I don't have any pain."
Yeah, that happens a lot.
I mean, that's amazing.
You have to stay away from the surgery if you can.
Oh.
First of all, a stimulator.
What is that?
Well, it's a wire they put in, and an electrical stimulation. You feel that instead of the pain.
Oh, so it's a mind
But
thing.
that is a failure of treatment.
Yeah.
So you never want to do that. You never want to burn anything out either. She had nerves burned out.
Oh, I didn't know that part.
Yeah, she had all kinds of things done to her. I mean, these people are just...
I saw the X-ray. They don't know. It's not that they don't know what
know
they're doing.
exactly where the pain is
Exactly.
from, is what I'm talking about. And if they use MRIs a lot, they're losing right off the bat because you have to find it by examination only. And so this man we're talking about, we'll take that pain right out. I know where it is just by what I was told over the phone.
Would she be? So that the girl that came in, is it difficult for her to get those things out and be treated the right
Screws?
way? Yeah.
No, it's not.
I mean, I saw a scar. I did see when I walked in with Nick.
But
I
you
saw the
can't-
scar tissue.
Can't get anybody to do it.
Oh, really?
Yeah, that's a shame.
So if you keep if you
Well,
keep,
I'm gonna develop a clinic in my kitchen. I'll put something down, use my screwdriver and just pull it screws
well, you
out.
said that you can take a
Oh,
screwdriver
my
and pull
God.
right. But it's horrendous when I saw that. I said, "Oh my God."
You see, when you treat these things every day and you know where the pain's from, it's rather easy to do it. You can do those things, and they work. Any surgery decreases your percentage of improvement. Try to get the idea. You have to understand what you're doing. You got to know if you're going to improve. Somebody's got to tell you yes or no whether you're going to get better or not. I will guarantee my work. You always get better.
And in fact, you even said to her, if you're still come back, I'll do the other side. You just told her. Well, what amazes, I'm always amazed at you. I mean, I know you're now going on 4 years, and every time I see something that I say, wow, you can't do it, you do it. And when you see someone that's teary-eyed, you say, wow, it makes your heart feel bad that you had to go through all that stuff, am I right? And Nick sees everything because he's there on almost every procedure.
Pain is very emotional.
It's a bitch.
And, you don't know what it's going to do to your body, what it's going to do to your lifespan. And what they tell you is the worst that you can hear. When I talk to you, I tell you where it is. And mainly pain is, you know what a pain actually is? It's a ligament. It's a normal ligament that's overused, causes a pain.
That's what the guy said
Yes.
in the article. Yeah, everything you
So
said.
he agrees with me, huh?
Yeah, I mean,
Who is this? Who
I
is
went
this
to look at his name.
brilliant guy?
What I'm saying is he doesn't have his name on the article, which I just went with, and I guess he's either a orthopedic surgeon who realizes that everything you said is true,
Probably not.
or he's just someone that's observed. See, let me just say one thing to all the new listeners. Dr. Pannozzo is also a medical doctor specializing in musculoskeletal problems from pain.
Ohio State.
From Ohio State, okay? The big O that owned, I mean, that's the guy I want to see because Urban Meyer is one of my favorite coaches. I like him a lot.
It was every Saturday football game.
That's right. And in those days, they didn't play with helmets, right? Going back, how old you are, okay?
You know, they still haven't fixed the helmets so you don't get a neck injury.